My name is Santosha, and today I'm going to be talking about my project, which is Parkinson's disease, an overview of its neurophysiological effects and potential treatments. This presentation will start off by giving an overview of what Parkinson's disease is and how it's characterized by the freezing of gait, what therapies have helped the freezing of gait and whether they're effective or not, and also introduce my potential therapy, which is sensory and auditory cueing, as a means of promising results and its impact in science today. What exactly is Parkinson's disease? PD is considered one of the most common neurodegenerative disorders in America. Being the most common, we would expect that there was some type of cure. However, PD remains an outlier with no long-term therapy that's effective and no cure to help mitigate the symptoms of Parkinson's disease. Those with PD are often experience loss of cognitive functions, which is mainly due to two reasons. One of them is due to the caudate nucleus, which is responsible for planning and execution of movement, learning, emotions, and etc. And also because of the significant loss of dopaminergic neurons in the substantial nigra. The main reason I wanted to write this article is to explore the complex nature of Parkinson's disease as one of the common disorders and also shed light on the fact that we need means to an effective and accessible therapy, mainly because of the lack of efficiency in current therapies today, and also because of the lack of healthcare access to these healthcare therapies with people that have low socioeconomic standing, so they can't receive the same amount of treatment. So first of all, Parkinson's disease is characterized by the freezing of gait. The freezing of gait is often a condition of sudden involuntary movement in advanced stages of Parkinson's disease. So this is characterized by a loss of function, independence, and simple movements like turning, small steps, or passing narrow doorways that we all do on a daily basis. This is mainly due to the imbalance between the subcortical and cortical brain activities, which create these freezing of gait episodes that are going to be mitigated by therapies today and my potential therapy. So what current therapies are in the field today? We have levodopa and stem cell therapy as two of the major therapies today. Levodopa is a medicinal drug absorbed by nerve cells in the brain and turned into chemical dopamine. This diagram over here gives you that description, where levodopa is inserted into the cell and vesicles with transmitter dopamine absorb the levodopa, which pass through multiple synapses, where the message is then passed on to receiving cells. So levodopa essentially inserts itself into the cells that PD is destroying in order to mitigate the effects of PD. While this is a good short-term therapy, in the long run, this doesn't happen. Because levodopa doses have to increase over time, this does not seem to be a good long-term solution. A study in 2004 actually showed that increased levodopa doses have showed increased bradykinesia and nausea and vomiting, which just worsen the conditions of patients with PD. On the other hand, we have stem cell therapy, which is 3 types of stem cells that are used to repair cells and further mature cells. While this is also a good short-term therapy, it is also not a good long-term therapy, mainly because of its excessive amount of cost, which doesn't make it accessible to those with lower socioeconomic standings. Also, since PD is not completely cured and stem cell therapy is just another therapy, the PD does continue to destroy the new cells that stem cells introduce, which make it an on and off cycle with destroying and creating and destroying and creating. This is why I research sensory and auditory cues as a mean of potential therapies. Let's start off with sensory cues. First, we have to understand how the brain normally works. The brain cerebral cortex works where dopamine transmitter pathways are inserted into the striatum, which is responsible for movement. However, with the brain with Parkinson's disease, the cerebral cortex striatum doesn't receive dopaminergic pathways, so then its movement functions can't happen properly. So sensory cues have been introduced as an efficient and accessible therapy. A study to conduct sensory cues had subjects physically execute and visually imagine goal-oriented tasks. This study actually showed that these tasks reduce the patient's bradykinesia and increase the speed of both imagined hand movements and eye movements, which are what were being tested in the study. The study also concluded that the cues may have helped patients bypass defective basal ganglia circuits by reducing the load and overcoming these freezing episodes that we mentioned earlier quicker. The whole key is to reduce the freezing episodes because those are what cause the loss of functions in PD patients. Other than sensory cueing, auditory cueing has also showed promising results. While I talk about the multiple brain regions, you can take a look at this diagram to get a better, accurate understanding of what I'm talking about. Auditory cueings have been shown to activate regions like the cerebellar, which is known to perceive rhythm. So continuous footsteps were played, and PD patients tried to imitate these actions and eventually recreate them. So it was shown to stimulate the cerebellum, brainstem, sensory motor cortex by instigating reorganization of these circuits. Essentially, rhythmic cueing had been shown to preserve these neural centers that are involved in perceiving externally cueing cues as goal-oriented movements, which is what they did with recreating these continuous footsteps. Overall, through this article, I hope to shed light on the fact that we need an accessible therapy in today's world that are both accessible to low socioeconomic standings and those who need potential therapies. Thank you.